In this video, we'll learn about Addison's disease. Addison's disease is also known as primary adrenal insufficiency. It's a serious condition where adrenal glands fail to produce enough of very two important hormones, that is glucocorticoid, that is cortisol. Another one is mineralocorticoid, that is your aldosterone hormone. So there is deficiency of both cortisol and aldosterone in this condition. The most common cause of Addison's disease in developed countries, if you see, that is an autoimmune destruction of the adrenal gland. So there is an autoantibody produced against 21 alpha hydroxylase enzyme, and this is a key enzyme in the pathway which produces cortisol and aldosterone. Okay, so when the enzyme itself is destroyed, the adrenal cortex is not able to produce cortisol and aldosterone. The same if you take in developing countries, tuberculosis still remains the leading cause of Addison's disease. This tuberculosis infection, it spreads via blood and it affects both the adrenal glands. Okay, so and it can damage them and can lead to deficiency in these hormones. What exactly happens in tuberculosis is there is this granulomas forming around the bacteria. So there's a granulomatous inflammation which starts, and this inflammation will lead to destruction of nearby normal cells of the adrenal cortex, so thereby leading to insufficiency. These hormones are reduced now. So what are the symptoms of Addison's disease? Okay, if you see, they'll have fatigue, hypotension, and hyperpigmentation. These are like very important symptoms. There can be so many associated symptoms. Okay, now cortisol normally, it is called a glucocorticoid. Okay, it regulates glucose mainly. It increases blood glucose level. Remember, that's a primary action of cortisol. So whenever you face any stress, cortisol is released so that it releases glucose that can help us in combating the stress. So now imagine cortisol is not there, so glucose is not there, it leads to fatigue. Now, aldosterone is a mineralocorticoid. It regulates sodium reabsorption mainly. So, when sodium reabsorption is affected, if aldosterone is not there, patient will have hypotension. The BP reduces. Now, to increase both cortisol and aldosterone, ACTH will be released from pituitary gland. ACTH has it has a melanocortin-like action. Okay, so that's why it causes hyperpigmentation. If you see the nail bed and the palmar creases and the knuckles and all will turn black. That is a classical. This is a hyperpigmentation. This indicates there is excess of ACTH production in the body. So remember, Addison's disease, there is reduced cortisol and aldosterone. So the classical presentation is there is fatigue, hypotension, and there is hyperpigmentation because of increased ACTH. The most common cause in developed countries is autoimmune disorder, antibody against 21 alpha hydroxylase. In case of developing countries, it is tuberculosis, where the chronic granulomas will form in the adrenal cortex. Thank you.